name is Tariq. I'm from Detroit, Michigan. I'm a former professional road-rated boxer, and my nose is crooked, up, botched. I mean, I've gotten cut hair all the way to my eyebrow. I've actually had a hole in my lip before. But these I don't mind, wounds of battle. This, wounds of a botched surgery right there. Look at my nose from here, no one can tell. But when you look up, bam! It's not from boxing, that's from that doctor. I started boxing at 8 years old. When the first day I put gloves on, I knew that this is my life. When I was 20 years old, I made the finals of the Olympic trials, and I turned pro after that. I became a road-rated boxer. I won the North American Middleweight Championship, and I retired. About 3 years later, I got a phone call from Sylvester Stallone telling me that they're doing a boxing reality show called The Contender. It was a good opportunity, but after the show, I went back into retirement again. What are you in town for? I gotta go see a doctor.
Doctor for what?
I'm having this where it's crooked. Fixing up. Straighten it out. I've broken my nose a few times in boxing. Going 10, 12 rounds, it's gonna affect your breathing. So I went in for a consultation with a doctor to clear my nasal passageways. He's like, yeah, we can do that without messing with the nose. I went into surgery to correct my breathing. I came out, not only with a crooked nose, an even worse problem breathing. The doctor's like, it's gonna straighten out, hopefully as it heals. Months went by, nothing changed. I wanna get this straight, get my breathing better, make my appearance be straight. That's the only reason why I'm doing this. I know the boxing game, so I've been trying to manage a couple fighters. I promoted a few boxing shows. Once my nose is fixed, I want to take it to the next level, work with an agency, making more public appearances. Because right now I go to schools, talk to kids about setting goals for themselves. They're looking up at me, kids would be like, oh, what happened to your nose? And if it was from boxing, I'd be proud to say, hey, you know what, it's from boxing, but it's not. I don't want to lie to these kids, but this doctor screwed up, I want to get it fixed.
That's it, again.
Have you ever gotten hit in the nose?
Yeah? Why? You?
I've been hit in the nose probably 3 or 4 times. Not since I had my nose done.
Fighting?
Yeah, back in college. I was in a crazy fraternity. And I got hit pretty well in the face.
I mean, I got in some fights when I was a kid, but
Yeah.
I didn't like being hit.
No, of course,
you
no
know?
one does.
I mean, if you think about it, we can do high-level surgery, but really what else can we do?
Brings me up to the next patient. His name is Tariq. I think he may even be Lebanese.
Oh, like you.
Yeah.
Hi, doctors. This is Tariq and his wife, Dina.
Hi, how are
Dr.
you,
Nassif. Dina?
Nice to meet you.
Terry
Dina.
Dubrow.
Cuz,
too,
finally,
you too.
finally, Doc, how are you?
So wait, are you Lebanese?
Not
boy,
Lebanese,
too?
brothers.
There's an immediate connection between Paul and Tariq. I feel like I'm an outsider of the Lebanese club. See,
Right.
he refers to himself to me as a Lebanese god. Now this is a Lebanese god.
Yeah, he
okay,
is.
this is
I'm
what
a-
I
yeah,
think
this guy's
of when
like
I
an
see a
actor.
Lebanese god.
So I mean, you're an amateur boxer or did you go pro?
Professional.
Okay.
Yeah.
Top 10 of those are professional.
So you retired.
Retired from boxing.
Okay, now give us a little feedback of what's happening with you.
I broke my nose a few times from headbutts, elbows. It got to a point where it was really affecting my breathing during my career. I went to surgery to get my breathing corrected. I came out with it worse than when I went in.
Let me ask your lovely wife, Dina, a question.
Yes.
Does this affect you?
Appearance-wise, I don't see
She
anything
says,
wrong.
she doesn't see this, Doc.
Well, that's called love.
Yeah.
That's what I told her, the spell.
I think he looks fine the way he is, and I'm kind of hoping that he's not going to go through with it.
My
What about-
concern is the recovery time. I'm more concerned about the recovery than I am the surgery.
She's worried about taking care of me.
Is he a little bit of a wimp at home?
Yeah, well, if he has a cold, I ask him if he wants to go to the ER.
You want to go to the ER?
You gotta go to the ER, yeah. I could be a little difficult to deal with if I'm in pain or having a hard time. I'm just impatient.
I think that's men in general.
Well, it is men.
It is
Men's
men.
a little
Yeah.
wimpy.
It is men.
Right?
That's why women could have babies and men
Exactly.
can't.
I think I could have a baby. I think I'd spit one out. No big deal. Go right back to work.
Spit one out.
Just saying.
Oh,
Yeah,
Jesus.
no big deal.
So let's go to the exam room and we'll take a peek, okay?
Okay.
I'm hoping the Doc is able to do this because when I'm promoting fights, managing fighters, I shouldn't have to worry about people questioning what the hell happened to him.
Do me a favor, put your head back. Oh, yeah.
Wow.
Tariq's septum is one of the worst that I've seen in probably 10 years. Breathe in and out for me. Now watch this. Breathe. Better?
Yeah.
Oh, yeah.
So we need a piece of cartilage here to open this up.
Damn, I can
Big
breathe.
difference, huh?
Oh man, huge difference.
Here.
Doc, you stay in shape, huh? You working out?
Me?
Yeah.
Yeah, I work out a little bit.
Yeah, come on.
I notice you're not saying that to him.
Yeah, I already know he works out. I can tell.
Come on, Terry. You know I work out and I do look good. Thanks, Tariq. So all the cartilage has been removed already back in your septum. So there is no available cartilage for me to use. So that's why we have to use a little piece of rib. Do me a favor, stand up, just so I can show your wife and show you, lift up your shirt for me. All right, so right through here, you're gonna have a scar. I'm gonna take a piece of rib and put it just on the top of the left side of the nose, and that hopefully will just pop it out and make Tariq's airway bigger. Your muscle's pretty thick here, so let me just tell you one thing. You're gonna be a little bit more sore because you have a lot of muscle over that rib, which means...
No more recovery.
Oh, God.
Are you in?
Yeah, I mean, now that you show me with his breathing, and I see it, yeah. I feel more confident, too.
We'll be seeing you later on for surgery, my friend.
Appreciate it.
Great meeting you guys.
I feel so much better now that I spoke to Dr. Nassif and Dr. Dubrow. They seem amazing and they know what they're doing, so hopefully they're able to correct his breathing. I'm a little nervous about them having to take from the rib. I think it's going to be a long next few days.
All right, Tariq, are you ready?
As can be.
Come on back.
Born ready. Really?
The recovering time is going to be so awful. It's going to be very uncomfortable. He's going to have black eyes. His nose is going to be all swollen and stuffed, and I'm not looking forward to that. You hate to see the one you love uncomfortable.
Love you.
Love you. Thank you.
You're welcome.
After today, I'm gonna be able to breathe clearly. My nose is gonna be straight, and I'll be a lot more confident. I'm excited for that.
Today I'm operating on Tariq, and what's going to be difficult with his nose is getting that nose straight. Now, I told him that I would try to get the nose completely straight, and I always do, but I never guarantee that. So if I can get his nose 90% straight, I'm going to be extremely happy. Thank you all. For Tariq's revision rhinoplasty, we will first remove a portion of the rib to help rebuild. Then we'll lift the hood of his nose and straighten and strengthen the septum and bridge. Then use more cartilage to help rebuild his nostrils and open his airways.
Hi, how are you?
Morning.
Good morning.
I'm not feeling good. My head's pounding. I should be in bed right now. I should be sleeping.
Go ahead and sign in and we'll let them know you're here.
Thank you.
Thank you. Thank you. I'm hoping what I'm going through is worth it. And if my nose is straight and able to breathe better, yeah, it's worth it. But it feels like I got hit with a boom in a rib, you know, like all the ribs are broken.
Now I remember exactly why I didn't want you to go through with it. It's too painful.
In a couple of days, I'll be fine.
Tariq's in a lot of pain. I do have to baby him a little bit, so hopefully he recovers quick.
We're ready for you this way.
I don't think I ever got beaten up like this in boxing. The next day, I've never been like this. Like Rocky Balboa.
Hey, Doc.
My friend.
Look what you did, man.
Is he your friend?
Actually, I don't know, maybe I'm not your friend right now. How you doing?
Been better. Hey, got my rib, Doc. It's the rib.
Remember I was talking to you about the thick muscles?
Yeah.
Secondly, your rib did have a little bit of trauma to it. It was actually what we call, there's a little bit of, not calcification, but it was
Sticky.
It was
It was
sticky.
very
It was scarred
adherent.
there a little bit. Not a big deal. That can cause maybe a little bit more discomfort. What I've been finding out through my years of practice, the guys that act the most tough are usually the guys that handle pain the worst. So let me just do something. All right, let's see how you're doing here. Put your head back. Tariq's nose looks pretty darn good. I mean, his septum is pretty much darn straight. Not perfect, but a heck of a lot better, and his airway is beautiful. Let me put this back on. We have an excellent result so far. Okay? His nasal tip is going to take up to 2 years to heal. However, in about 3 months, he'll be about 80% healed.
All right, we're good. We're good.
I can tell he wants to get out of here. My friend,
Thank you.
I took good care of you. I'm very happy with everything.
I know you did. Thank you. Thanks, Doc.
Now he's in your hands.
Oh my
Don't
God.
be too much of a baby now. You know, follow instructions. Here.
The fight's not over yet. The fight started in the operating room. The fight's still going right now. And once the end result comes and the fight's over, hopefully I'm going to be the happy one. I'm going to see my man Sergio Mora, the Latin Snake, do his thing tonight. This is the first boxing event I'm going to since I had my surgery. I've kind of been hiding out, healing for months now. Now that my nose is fixed, I'm going to start attending more of these boxing events and social events as well. I'm going to see my man Sergio Mora. I haven't seen him since the surgery. I just want to see what his first reaction is going to be.
Hey, what's up, bro? What's up, brother? What's up, cuz?
Look at you.
What's up, cuz?
What's going on, man? Before my surgery, I was beat up, I was down, I was out. After surgery, I got up and made a comeback. And you tell me who the winner is. Champ!
Look at you.
Champ is here.
Let me see.
Don't hate, bro. Congratulations.
I'm not gonna hate.
Don't hate,
I'm not gonna hate.
congratulations.
You look great.
I love you.
You look great, bro.
That's
You
all
look
I
great.
want. I love you, man.
There's a hidden confidence that just came out. It exuded out of him. He needs to lift his head up, and you realize the masterpiece that Dr. Nassif did.
Dr. Nassif gave me the biggest beating I ever took in my life. Ever, bro. I'm telling you. He did an amazing job, Dr. Nassif.
So let me get this clear. Dr. Nassif beat you to the body, uppercut to the nose,
He might have.
shattered. The cut man here took care of you in the corner.
Exactly.
Now you're ready for round 12.
And I don't remember a thing, bro, from the surgery. Nothing. My wife put up with a lot. I had her running around everywhere, doing everything, helped me get out of bed, thankfully. Otherwise, I don't know what I would have done. Forget about that, bro. You ready for tonight?
I'm ready for tonight. Thanks for coming out. You look amazing.
I'm excited to be here. Thank you.
Good luck, Sergio. Initially, I didn't want him to have the surgery, but I'm glad he went through with it. I love the results. He's happy, and I'm glad it all worked out.
I'm feeling good. I can breathe better. I'm excited to network myself. There's a lot of big boxing people out here, fighters, managers, promoters. I took a break, but I'm back, and it's a great feeling. I know it's time to move on to bigger and better things.